Well, I think particularly if they're worried, I think if they develop a rash following a tick bite, it's very important they see their GP at that point. It's very helpful if people can record pictures of any rashes they get on their mobile phone, because one of the difficulties is the rash can sometimes be quite faint and it can disappear. So if you've been in an area where ticks are present and you come out in an odd rash, particularly ones, say, behind the knee or on the trunk or on your back, at that stage, get somebody to take a photograph of it if you can't see it yourself, and go along and see your GP. Well, if they can remember getting a tick bite, that's very helpful and very important to explain to their GP. But even if they can't actually remember getting a tick bite, but they were just in an area where there are ticks and they've developed an unexplained rash, then they should explain that, because not everybody can remember actually having a tick bite, and sometimes the tick can drop off having had its feed, and if it's on part of the body you don't normally see, say behind your knee, you maybe don't know that you've been infected by a tick. So if something odd develops, say just take an example of a knee, so sometimes ticks attach onto the behind the knee in people. So if you develop a hot swollen knee in one leg, then go and see your GP and mention that you've been exposed to ticks. Or sometimes what can happen is it can affect the nerves that control the face and give you a facial palsy, a thing called Bell's palsy. That's a problem both in adults and in children. So again, there are other causes of Bell's palsy, but tick-related Lyme disease is definitely one of those causes. And if that is so, then you need antibiotics as well as steroid pills.